Hi everybody, I'm Dr. Kelvin Tan. I'm a specialist orthopedic surgeon who has interest in sporting injuries around the musculoskeletal body, such as rotator cuff tears, tennis elbow, hip, knee degenerative conditions, or ligament injuries. We see a variety of patients in our clinic, ranging from patients with sporting injuries such as ligament tears or tendon inflammation around the shoulder, rotator cuff tears, elbow, hip or knee conditions such as tendon inflammation or degenerative condition or sporting injuries, and then foot and ankle conditions such as plantar fasciitis or Achilles tendon inflammation or tear. Also traumatic injuries such as fractures. Not every condition requires surgery. Some of the non-surgical interventions that we do for patients are physiotherapy, the various type of injections such as steroid injections or platelet-rich plasma injection. Blood is made of what we call red blood cells, white blood cells, platelets, and plasma in general. And how is PRP derived? PRP is derived by spinning blood, which is taken from your cell, and getting the portion of the plasma that is rich in platelets, concentrated in platelet, while separating the red blood cells from the plasma, and then injected into your various parts of the body. So what's so special about platelets? Platelets serve many functions in our body. They serve to stop bleeding in our body. They help to regenerate and repair tissues that are injured. And therefore, using platelet-rich plasma itself has this potential of treating various conditions with the potential to regenerate, repair, and recover. There are many conditions that are suitable for PRP injection. So, like I mentioned, certain conditions such as tendon inflammation or tendon or ligament tears around the shoulder, we call it rotator cuff tears, tennis elbows, ligament tear around the knee, or inflammation of the patellar tendon, the MCL tear, medial collateral ligament, or foot and ankle injuries such as the anterior talofibular ligament tears or tendon Achilles inflammation or tear, including plantar fasciitis. Certain other conditions that are around the knee, such as degenerative conditions, also benefit from PRP injections. Okay, to answer that question, let me explain a little bit more about PRP. In general, there are many different types of PRP in the market. Many different ways of preparation, the speed of spinning, the time of spinning, the concentration of platelets that we get in the plasma. Different types of PRP are used for different conditions, and there are also many different ways of preparing the PRP itself. Most defining feature is whether one is leukocyte rich, which means that there is high content of white blood cells and therefore pro-inflammation, or leukocyte poor, which is not so pro-inflammation. So different types of PRP are given to different types of conditions around the human body, and also given in a different format in terms of number of injections. But having said that, in general, most conditions require 1 to 2 injections of the PRP. Typically, rotator cuff tears, tennis elbows, or ligament tears around the knee or foot and ankle, around 1 to 2 injections usually will suffice. But conditions such as osteoarthritis of the knee, most surgeons will give about 2 to 3 injections over a course of a few months. There's actually not much side effect associated with PRP because it's actually drawn from your own blood. We take out, we spin it, and then we get the platelet-rich plasma portion and inject back into yourself. So you can see that there is no no risk, absolutely no risk of what we call disease transmission or rejection because it's your own plasma. But as with any injections around the body, there are some risk of what we call pain around the injection site, bruising, or very minor risk of what we call tendon or muscle injury from the needle itself. But it's actually a very safe yet effective procedure. So, having heard my talk about platelet-rich plasma, feel free to approach myself or my clinic, any members of my clinic, if you wish to find out more about platelet-rich plasma or any of your conditions that you feel may be useful with platelet-rich plasma treatment. Thank you.